Hi, my name is Torsten Seidenstricker. I'm a dentist from Switzerland. I'm a GP, and in addition to my daily dental practice, I am the Chief Medical Officer of a dental network called CHEESE, which is, let's say, brand new in Switzerland. So we are on 7 clinics today, and so I'm managing my patients, so like the GP does, in addition to all of the administrative work that I'm doing for my clients. So on the regular base, I'm seeing the machines like the GBT machine, not only from the managing side, but I'm using it on a daily basis with my own hands for my patients. And that's why I hope to be a good person in order to explain, maybe to share my experience with the new GBT machine, and even in comparison to the prophylaxis master before. So I'm having both in my clinics and I'm using both of them. So feel free later on if you want to share some comments or if you have questions. I'm always open to answer and I'm always keen to interact. So maybe starting to share the experience with the machine when it came to the market, it was for me still quite forward to adapt to this technology because I was used to the prophylaxis master. So if you have that in your hands and you compare it to this one, it's even more straightforward, even more convenient and easier to learn. So the learning curve is not so steep. Because if you compare it, if you take out the handpiece, it's the same Airflow Max handpiece, but instead of having like 10 different buttons, you only have small, medium, and large. So about the power, so that you can have three things to regulate. When you take the handpiece, there's already an RFID chip in it that detects the handpiece that you put. That is the Airflow Max. It's always starting with the middle program, and you can easily, with one click of a button, lower or higher the performance so that it gets easier to use, or if you want to have less power on it. Um, and the machine itself, when it came into my practice, the very first thing is like the touch and feel. And I first, when I hold the handpiece, I think it's very similar to what you use, even if from the technical point of view, I think there is a new generation of maybe cables, or I don't know what inside. So let's see, for me, when I have it in my hand, it's for me the right weight, something that feels very nice for me. I'm a big boy, so maybe it's my own impression. I don't know if maybe very tiny little girls find it a little heavier, but heavy is very relative. I thought about 100 grams or something. It's not heavy at all. But as I'm using it on a daily basis, and even my dental hygienist colleagues, they are doing it like all day long. It's always important to have some convenient and not all these heavy devices all day long. And even for the patients, like for the comfort, so the Airflow Max is something which is absolutely uh, comfortable. The patients like it. The feeling is very nice. And I think the big difference that I saw was not only on the Airflow Max, but was on this side when you take the Kietson handpiece. And this one is really something where they put some more efforts in it, because even on the machine before, we already had this painless approach about it. So that means that the power of the ultrasonic tip adapts according to the surface, what it finds, if it's structures or not, and maybe the hardness of the things they want to remove. And this is even smoother. So they had, I think, quite a big research about it in order to detect really and adapt the power of the handpiece according to the surface. And that's not the power that you have to adapt manually. You can do it like from harder, but normally, if you stay on the middle program, that's what I do, and I go smoothly around the surface and it only swings in the one direction. It detects, I don't know, 100 times per second the hardness of the surface that you work. and it adapts automatically its power. So your movement is always smooth, and it's not you that has to push on the surface. And so this is like for my preventive approach, and talking about prevention, it's always my wish to remove all of the staining and all of the calculus, so everything is really clean, but without damaging it. And so if I compare it to my old school background when I was maybe 20 years younger, and I used the ultrasonic tips delivered with the normal dental chairs. There's only one power mode, and the power is always on the max. So that's why for the patients, sometimes it gets discomfortable, and it's another kind of work if you have to push with your handpiece, like still medical way. For this one, you just keep it smooth and you work over the surface, and every time you pass by, it removes all of the things that you want to remove. So really, this painless approach is something that is even better on the GBT machine, and I felt it on the prophylaxis master. And so from the handling, I'm a very tactile, I'm a handy guy. So sometimes when I just clean up all the devices or my assistants do, I love that, let's say, aluminium approach. So it's not cheap plastics. Everything is really high quality. It's tempered glass. Everything's really nicely done. And so this is something I am working in Switzerland, and we always have that idea of being high quality. And it's not only Switzerland, I know internationally it's that idea. The machine fits into that market because it's really a high-end machine. It gives us really a good feel about it. And if I feel that my patients, they get the vibe, they know about it. I always share the things that I experience, that I do. I explain my patients why I do it like this and that. And at the end of the treatment, say, yeah, yeah, I felt it. And really, it's clean and it was smooth and it was no pain. And it's finally for me, not only as the dentist, but now as the person being occupied with the management questions. It's always a very good thing that the people don't feel pain, that there's no scary things going on with practice, so that it's getting like a, I don't know if you can call it a wellness approach or something, but the sensation that my patients get when they come into the practice shall be always a very good first impression, and when they leave, it shall only be the same, so that they say, yeah, now everything is smooth and white and shiny, and I didn't feel no pain, and I am so happy to come back, see you back like a few months later. So that's finally how I can manage to get this recall visits quite fluently, because there was no bad experience about it, and the people like to come back. And so this is something which is very, very nicely implemented, not only in the machine, but all of the, let's say, policy, the GBT protocol behind it. So that something is very standardized. I can teach it to all my team. So all of my dental hygienists talk the same language somehow, and they know step by step what to do. So we have all of these 8 steps to go through from the beginning to the end. And sometimes we even challenge us and we play around, we add some little other steps, but we always keep to this GPT protocols. And that's why for me it's quite a no-brainer, I would say, to use this machine with that protocol, and everything is tailor-made to make it like a very smooth and convenient approach for the patients. And if it's convenient for the patients, then they will come back and they will be our advocates somehow to talk to their friends. So that's the very best way I can imagine to manage a dental practice. So when my team is really educated on these machines and they know how to communicate to the patients, and then the patients go out and spread the word to their family and friends. And so that's finally something that I have a very, very good feedback on all the GBT devices. And I see now with the time that even in the universities, when the dental hygienists are going to do their studies and to be spread out into the market later. They are already using these machines in the Swiss universities. And so when they come to the practice as a young practitioner, the very first question is always, okay, what kind of materials do you use? Threads or like GBT machines? And so it's always a very good hint for the practice owners if they want to find a dental hygienist, all the new technology, all the new devices, because everyone is hungry to learn about it, to work with the best products, and to stay safe all the way along with during their career. And so this is really a perfect match, talking about the GBT machine. So this is my very first impression that I had touched for the first time. I was one of the first users with the machine. And so that's why when it comes to the future with the growth of my clinics, that we have to acquire some more. For me, it's a no-brainer that we will have a look and we will ask some offers from EMS to install new machines. And this is something where I like a lot the approach from EMS when it comes to the installation. For sure, they have the small card that you can work it around, and this is maybe the most flexible way how you can manage it into a cabinet, or even if you want to move it from one chair to another, you just detach the cords and you bring it to the next chair and it works. Or you can install it like there are many chairs where you can have an extra arm, or you just add the support like this one here, which is a bigger chair, so that you have it already next to your chair and you can just use it. Because for the setup with the dental hygienist, there is nearly no case where you will not use it. So it doesn't mean that the threads or handwork is completely over. That's not the case. Depending on the situation of the patient and depending on his background, sometimes they have to remove lots of stone. And so sometimes if we proceed even over this, or 99% of the cases, they go into the GBT machine, ultrasonic device, airflow max, according to the GBT protocol. And so that makes perfect sense. The only thing which I see what we use less and less is the polishing paste, with this small brushes. So that's why my dental hygienist normally, when they have finished with the dust powder, when they are done, sometimes they even apply some fluorides at the end, but then the normal dental hygienist cleaning is over, and the patient gets his follow-up visit. And so that's why this machine is something that works quite nicely into my daily workflow, because I can combine it without changing my setups. And even if I have like the former version with the prophylaxis master, and I have like the cards or I have installations like this and I update it, it's quite plug and play. I remove the old one, I put the new one. I don't change them now for the fun of change. So if the machine still works and everything works fine, I keep it until the leasing is over. Or if I have to install something new, I always go for the new one now. And this is for me like the best feedback that I provide from my own experience, because we are seeing hundreds of patients in Switzerland every day. And so this is something which is completely installed now over my clinics and which is giving a very, very nice outcome. And the feedback from the patients is positive, is very overwhelming positive. Now, if there may be any questions about the device, feel free maybe to ask questions. I'm always hoping for some input because I like the interactive way. So if there is any question right now.
So far, not yet.
Okay.
Let's let the people a few more minutes, maybe.
And then if I'm looking like on the experience now in the dental practice, it's not only the dentist or the dental hygienist working with the machine. At the end of the day, when it comes to cleaning up everything, closing the clinic, and preparing it for the next day. Everything is like perfectly foreseen from EMS, because there will be like a night cleaner bottle which is installed here, which is like a blue pint of water with a special product. And then you just take the two end pieces and you lay it over with a small cleaning device here. And so it cleans up on itself, it takes like a minute. And then it stays during the night so that everything inside of the cords is being completely disinfected, because if we're talking about biofilm therapy, we have to take care of the biofilm inside of the mouth, and we have to take care of the biofilm inside of our installations, even in the chairs and even in the machines, because the biofilm is going to be everywhere and needs to be taken care of. And so the whole setup is like a journey. So from the moment when the patient arrives, already looks quite fancy. Looking from the outside, some patients told me, oh, it looks like an espresso machine somehow a little bit. Yeah, and I think that maybe one of the designers was connected to an espresso. It looks like that. So it's already like the very first touch, even without touching, but the very first contact, the very first impression that is positive, and which just starts the good feeling and starts the journey. Then during the treatment itself, as everything is being optimized to be comfortable, to be like good smelling, good tasting, no pain, that's finally the major thing for the patient, because when you come to the dentist or if you go to the dental hygienist, even if you are relaxed, you still have this uncertainty, this fear somehow, maybe to be judged or to suffer from pain. And so with this kind of approach, it works perfectly well. And so I always ask all of my staff if they want, for example, the dental hygienist, if they want to use the machine, courses where you learn how to handle the machine correctly, how to apply the GBT protocol, so that step by step you get a real guideline and a workflow to follow, so that you can deliver the best outcome. And it is something, once you learn it, you will never change that way, because it makes perfect sense. And that's the best and optimized way to get the outcome that you need. And having not only removed all of the staining and all of the titles, but having the overall situation and having discussed with your patient about his situation, about the solutions, about further prevention, home care, that what he has to apply in order to keep everything healthy. Because the dental hygienist, normally in my protocols, maybe it's like twice a year, but the patient brushes every day, so that means his own cleaning at home is maybe even more important, because it's daily based. And so that's why I always like that the combination in the GBT protocol provides the holistic view, reminds the patient on all of things. It's not like I'm hiring a cleaning lady, so something is clean and I don't have to work anymore. And I think that it's even our job as a dental professional and as a dental hygienist in order to experience, to give the patient the right experience, and to share the knowledge and to educate, to coach them somehow in becoming, let's say, the best brusher in the world. So that finally we take not only care of this microbiome and biofilm inside the mouth, but it's always this mouth-to-body connection. So finally, when we treat all these gums and everything is healthy here, we will have a better overall health, and we can even have an impact on other diseases like diabetes and many others. So that means we are on the forefront somehow in order to keep the patients happy. And that's finally the reason why I think that if we talk about prophylaxis and about prevention, we're not stopping with the machine. This is one block in the puzzle, but we are talking about the care that we will give, that we provide to our patients in order to make them healthier all life long. So maybe they start when they are young, and hopefully they will stay until the very last day of their life, in order to have everything, all the teeth there, all the gum there, everything healthy. And even if there may be some accidents or things happening during life, that we always adapt with our protocols and with our means to their health situation and to always get the best outcome. And so my feedback that I can provide is that with the setup from the machine itself or the hardware, then the skills that you learn by going to the MS courses and applying the GBT protocol makes just a perfect sense, closes the circle somehow, and so it gives you the right way and the right movement in order to be good to your patients and to be good to your practice owner, because it's always a question about the benefit, not only from the medical point of view for the patient, but even from the economic point of view for the practice owner. And it's a win-win situation for both of them. So I can only hope that you get the machine and that you will experience it on your own.
Great, thank you. So we got a few questions actually. So the first one is, what are the contraindications for using the GBT protocol?
So contraindications are little. Sometimes, and that's why with the GBT protocol, you always have the very first point is to evaluate the situation. So you will start to, maybe there's a questionnaire in the first front, where you answer questions about his health. There are some relative contraindications. So if someone had freshly heart attack approach where they had to operate or something, then there is sometimes in the first half year the time where we say, okay, we try to go into your pockets or into the infected area. So maybe we just wait a little bit we are cleaning. So finally, what I would recommend is just to take on Perplexity or maybe Google, where you say, okay, what is the GBT protocol and what are the, as you mentioned, contraindications, but I'm not using because there are very little but very medical indications where sometimes you may say, okay, judging the risk of going into an infected mouth in a weak patient, freshly operated or immunosuppressed, something like that, where we would maybe just step back a little bit and just delay the treatment the time needs in order to have a normal, general, healthy situation. 99% of all our populations, 9%, are absolutely fine with the products. Some medical things we always hesitate during pregnancy if it comes to a pregnant woman. And even with a GBT machine, I always try to put the cleaning session in the middle of the pregnancy, not in the first 3 months, maybe not in the very last 3 months, because I don't want to have to give birth in my chair. So the middle of the pregnancy is just the perfect moment, because you know that during the pregnancy all the hormonal changes are going to reactivate all of the reactions of your mouth. And so if you clean it up well, so probably you don't have all the problems that become at the end of the pregnancy. So, but this is not a contraindication, it's only a hint where I would say, please try to put it in the middle of the term.
Great, thank you. So we got another question. I'm wondering, do you actually refill the water before each patient or how often?
It depends on your installation. If you have like a water bottle, you can do like this. Or normally I have a small cord where it just plugs into my chair, and it has a permanent water, like in my dental chair, it's a permanent water application. If you choose the bottle version, then probably the bottle will last for maybe 2 or 3 patients, depending on the length of the appointment. And so there is no contamination coming from the part that you are working inside of the mouth, so which is contaminated, but it's not going inside and not going back into this water bottle. So that means there is no risk if you change then the airflow marks and you disinfect all of the cords. There's no risk that something that you worked with the patient before comes into the water for the next patient. Yeah. And so depending on your setup in the clinic, if sometimes it could be possible if there are breaks in between patients, break at 12, my dental hygienist goes to eat and she puts this small cleaning water inside and she lets it run for a minute. When she comes back, she cleans it with the normal water again and she goes. So there's no hesitation to apply it during the daytime if the agenda allows it. In the normal setup, during patients, if it's well scheduled, maybe you don't change the bottles, but you can keep one and you can disinfect and change all of the hand pieces. And so it's enough that there is no risk that water which is inside this sealed water bottle is completely contaminated.
Thank you.
Right.
So we just got some comments, not really questions, but we got a comment from Korea. This course is really useful. Unfortunately, it's not yet widely known in Korea. I also hope there will be an English GBT course available in Switzerland. And another comment, I use Airflow Prophylaxis Master for 4 years. My patients and I are very happy.
Yeah, I can share that the experience is the same in my place. And now, if you have a prophylaxis master and you're happy with it, keep working with it. When it comes in the future to a growth where you say, oh, I need to have something additive, then try out the GBT machine, and I think you will find the same satisfaction. And yeah, maybe it's a personal question, but if I have the choice between like a aluminium tempered glass high quality machine or the old one, which was not bad quality, but which was still like plastic, I prefer to have this handling feeling and to have this really nice approach. So I'm a tactile guy. I'm as a dentist, so I need to feel the quality of the end pieces that I use. And this is something that it gives me satisfaction to work with the machine.
Great. So one other question, how do you remove disclosing solution stains from white suction tips?
So these stains, they are made in order to disclose all the plaque. They are really stained. If there are other things that are contaminated, maybe your tips, or maybe you put it like on other surfaces. Sometimes, depending on the materials that you use, if it's like aluminum, it's no issue. You just clean it up. And depending, I had once with a patient of mine, and this was our fault when we covered the plaque. The small piece just fell down on a t-shirt and made a stain on a t-shirt. That was our fault. So we reimbursed for a new t-shirt. We said, okay, it's our thing. Because maybe you could wash it out. I think so. But from now the practice owner point of view, I am always keen to have my patients satisfied, and the spread of word that they tell to their friends, they say, okay, they cleaned up everything and even reimbursed my new t-shirt that I had to order. Yeah, if there is a critical situation, try to work around it. There is now talking about the staining itself when it comes to suctions or something. There's no medical, there's not only one solution. Try to rub. Very first reaction is always to take a little bit of alcohol and try to get rid of that stain if it works. Sometimes orange oil may work. depending on the plastic that you use, because finally it's always the material properties or the things that got stained. It's like aluminium, you know, the surface is inert, there's nothing going to stay. Plastics depend, sometimes they are not very well finished, if they are rough on the surface, wood plastic and get roughish, and maybe you don't get it away. And then maybe you just should change sometimes the older plastic stuff, which is not meant to last forever. That's what I would do.
Thank you. So, in the meantime, we did not get any more comments.
Okay, thank you very much. And for the colleague from Korea, if you're interested to see like these courses, the GBT therapy, fly over to Switzerland. I know that AMS is giving a very regular year, and my dental clinic is just 500 meters over the street. So you're very welcome to take a coffee, and I invite you.
Great.
Bye bye. Take care.
Thanks.
Ok, super.
Les sujets, donc j'ai parlé comme ça de
Oui.
mes expériences.
Oui.